Hey everybody, it's Dr. Groff. I figured today we talk about an issue that comes up a lot. Patients come in asking for a Fraxel, okay? So what a lot of patients don't understand is there's 3 different Fraxel lasers that we use. We have them all here, which is great. Now, you'll see right here we have the Fraxel Dual machine. This machine actually has, if you look at the screen, it has 2 wavelengths. 1550 and 1927. Those are 2 separate laser beams, okay? The 1550 we use a lot for acne scarring, surgical scarring, and textural improvement. Fine lines, wrinkles, pore size, that sort of thing. Now with that laser, after a treatment, you're gonna look like you have a sunburn. So it's not a lot of downtime. There's no bleeding, there's no oozing, there's no special wound care. Basically just try to avoid the sun. So not a lot of downtime, but we get great results. We usually do a series of treatments with the Fraxel Restore. Now let's talk about the other wavelength in this machine. That would be the 1927 wavelength, and that wavelength we use a lot for pigmentation. So if I have a patient who comes in with a lot of sun damage, a lot of brown spots, if you look at my before and afters, you're gonna see I have a ton of before and after pictures of patients who have used the Fraxel Dual on, and that's what we call the Fraxel Dual, the 1927 wavelength specifically. But that's excellent for pigmentation. So things like sun damage, we use it in some patients for melasma, depending on the case, and any brown dysmorphia. The other Fraxel that we have is called the Fraxel Repair. Now the Fraxel Repair is the most aggressive Fraxel that's made. It's a fractionated CO2 laser. That laser actually vaporizes tiny columns of skin, and that skin is replaced with new collagen elastic tissue, so it has a rejuvenative effect. We use it for photo damage, sun damage. We'll use that for acne scarring as well if someone wants a more aggressive treatment. It's great for lines, wrinkles, and textural improvement as well. Now it does have more downtime than this laser. You definitely need at least a week, and you're going to be doing some special wound care. There will be some pinpoint bleeding of the skin. There'll also be a little bit of oozing. And we usually have patients keep a nice thin layer of ointment on their skin after treatment. So those are the 3 Fraxel machines that are made. We have all 3. The last important thing I'd like to mention is I've seen so many patients that have come into my office and they've had prior treatments which they thought were Fraxel. Well, it's very easy for me to jump online and check out the various places they go, and I would say probably 7 out of 10 times they haven't actually had Fraxel, but they've had a copycat machine that is marketed as a Fraxel, but it's probably just a fractional treatment. But this is the original Fraxel that came out in 2005. Now this is the newest version. Every few years they put out a new Fraxel, kind of upgraded, faster, more powerful. This is the newest one. So when you're doing your research, make sure that you're really being treated with the Fraxel laser, not just a fractionated laser that's a copycat. So that's my 5-minute spiel on Fraxel lasers.